Tonight, we are going to be talking about pancreatic cancer. We're going to be talking about prevention and our flat belly lifestyle, as well as our CBD products as it relates to pancreatic cancer. I was asked by a distributor to talk about this topic. We've talked about cancer in general, but we've not touched on pancreatic cancer. I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana and one of the 4 co-founders. And I want to welcome all of our guests. I want to welcome all of our business partners. Welcome, welcome, welcome. A little bit about myself. I'm an obstetrician gynecologist of over 30 years. Of course, every Wednesday I'm here on call on labor and delivery. I attended Wayne State School of Medicine in Detroit, Michigan, completed my residency right here in Chicago at Cook County Hospital. I'm the CEO of RJM Wellness and Rita Fitness. I'm also really into women's health, wellness. I've spoken all over the world to women about and empowering them about their health. I'm a certifying physician as well for the Medical Marijuana and Opioid Exchange Program here in Illinois, and I'm a member for Doctors for Cannabis Regulation. And again, I'm one of the co-founders and Chief Medical Officer for Wakana. So let's go through some of these slides and let's see what these folks had in common. So we have Steve Jobs, who passed away in 2011. We have Aretha Franklin, who passed away in 2018. Alex Trebek from Jeopardy in 2020. John Lewis, 2020. And Ruth Ginsburg in 2020. What do they all have in common? Well, unfortunately, they all passed away from pancreatic cancer. We are going to talk about how CBD not only has been shown in research to help boost survival rates for patients who have pancreatic cancer by 3 times, but also to really discuss how we can improve the end of life for those who may have end-stage pancreatic cancer and really help their symptoms as they're even going through treatment. So what is the pancreas? It's an organ that lies right behind the stomach. It is very close to our small and large intestinal tract, our stomach, our esophagus, and it is really important for digestion. See, the pancreas makes very special juices called enzymes. These enzymes are able to break down sugars, they're able to break down fats and starches, and the pancreas makes hormones. When we talk about our black seed, right? We talk about how black seed can rebuild the beta cells of the pancreas, but a very, very important hormone that the pancreas produces is called insulin. So when the pancreas is not working well and it's not producing enough insulin, then that means it can't help to reduce blood sugar. And so this is when we have type 1 and type 2 diabetics that have blood sugar issues, as well as folks who have digestive issues. So the pancreas is a very, very, very important organ, and it lies right there in your abdomen. Well, cancer of the pancreas can occur by attacking 2 of the specialized cells that are in the pancreas. One are called the endocrine cells. Those are the ones that secrete the hormone insulin into blood vessels. And the cancer can also attack exocrine cells. And those exocrine cells are the ones that secrete those enzymes that we talked about. So you can have a cancer of the pancreas that is endocrine related or exocrine related. So the endocrine related type of pancreatic cancer is adenocarcinoma. Adenocarcinomas typically begin with the exocrine cells responsible for producing the pancreatic enzymes. And the neuroendocrine tumor typically begins in the endocrine cells responsible for producing hormones. Either way, pancreatic cancer is a horrible, horrible cancer to get. It affects males more than women. It's the 11th most commonly diagnosed cancer in men. It's the 9th most commonly diagnosed cancer in women. And the 5-year survival rate is only 8%. So it's really low. There's a lower risk in India, but this cancer is known as a silent killer. It's like ovarian cancer. I deal with a lot of ovarian cancer in my field of OB-GYN, but this is another one that's a silent killer. Why? Because there's not a lot of symptoms that folks have in the early stages of pancreatic cancer. So this is a bad one to get, but if you know someone who has pancreatic cancer, or if you, after this Zoom webinar, meet someone, just know that we have so many products can assist and address their symptoms. So what are some of the symptoms later on? Well, there's something called yellowing of the eyes or the skin. It's called jaundice. It has a very distinctive color, yellow. It's pretty bright, especially in African Americans. You know, the white of our eyes should be very white. And when someone has pancreatic cancer and they have jaundice, the bile is not being able to be filtered in the blood. It starts to build up. They also have unexplained back or abdominal pain with unexplained weight loss. And again, because the pancreas is an abdominal organ, typically they'll have pain near the right upper quadrant. They may have pain in the back as the tumor starts to spread, and they may, of course, have weight loss. Another very, very suspicious concern is someone who has late onset diabetes. That's a warning sign that something could be going on with the pancreas. So late onset diabetes, along with unexplained back or abdominal pain and unexplained weight loss and yellowing of the eyes and the skin. So unlike other cancers like breast cancer, lung cancer, cervical cancer, prostate cancer, see, all of those cancers have screening, either blood tests or imaging or x-ray, where there's really no recommended routine screening to detect pancreatic cancer. And again, not to bring up ovarian cancer, but ovarian cancer is that other cancer that's a silent killer. There's not really any routine screening like we have getting a pap smear every year or getting a mammogram every year, or men getting their prostate checked every year with a PSA blood test or x-rays of the lungs. Pancreatic cancer, there are no screening tests. Again, the symptoms typically present very late, and those are some of the symptoms. What are the risk factors? And these are some of the things that we want to talk about with our flat belly lifestyle. Let's talk about prevention, right? Let's really help our family, our friends get into prevention. Let's not wait until a cancer, a disease has started to affect our body. So some of the risk factors for pancreatic cancer, as with all cancers, are diabetes, advancing age, a family history of pancreatic cancer, smoking, obesity, and that's why we're really big with our flat belly lifestyle, right? We want to really help reduce obesity. We want to help reduce comorbidities like diabetes, hypertension. We've got products in our CBD line to help reduce those who smoke. We really can't do a lot about you getting older, but we can do something about these other risk factors. Heavy alcohol use. I really recommend that if you drink alcohol, even socially, try to limit it to very, very, very rarely, or even eliminate it altogether. And then pancreatitis. Again, that's inflammation of the pancreas, which can be a risk factor. How is pancreatic cancer diagnosed? Typically is diagnosed with a CAT scan. An MRI can be used as well, but the CAT scan is a gold method for diagnosing pancreatic cancer. There are actually 4 stages with pancreatic cancer. Stage 1 is very, very beginning. You can see there's a small nodule in the pancreatic duct that is getting bigger in stage 2. Then you start having spreading of the cancer from the duct to the gland to the overall organ. And then stage 4, which is not shown here, is distant metastasis. That's when the cancer starts to metastasize to different organs, and it is end stage at that point. There's lots of treatment options, though when one presents with pancreatic cancer, it typically is a stage 3 or 4. At that point, there's really not a lot that we can offer those patients outside of comfort care, outside of just making sure they're comfortable, they're out of pain. And this honestly is where a lot of our CBD products will come in, just helping those patients to reduce their pain with our topicals, with our gummies, with our tinctures, helping them to address acute onset of pain with our smokeables, and even talking about preventing pancreatic cancer in those that you love and you know that have diabetes, they're obese. You already know they have some of these risk factors, and you want to introduce them not only to our CBD product, but to our flat belly lifestyle. So yes, pancreatic cancer can be treated with chemotherapy. Typically that's what the treatment is, because it's usually too far advanced for any other modality like radiation. But again, it is a silent killer. So let's move on to our product line here at Wakana. This is the disclaimer that especially when we talk about sensitive subjects like cancer, in no way, shape, or form are we saying that these products can cure any cancer, pancreatic cancer, any cancer, or any disease. So we cannot make those claims. We can't override what your physician is doing. So that's why we always recommend that you speak with your physician, that you engage your physician with a lot of the information that we talk about and the products that we're recommending. Knowing that the physician can then tailor your treatments. The physician can also recommend that you're taking your CBD products or your detox flat belly lifestyle products in appropriate timing of chemotherapy, if you're undergoing chemotherapy, etc. So first, let's talk about cannabis. Cannabis has 2 species. And I was on the phone with Cheryl Johns yesterday with one of her customers, and really helping the customer understand that none of our products will give you a high, a euphoria, or a paranoia. And the reason being is that our products are sourced from the hemp species. The hemp species of the cannabis family has 0.3% or less of THC. It's such a small amount of THC, which is very high in marijuana. The percentage of THC is high in marijuana, and that's what distinguishes one from the other. Marijuana has a high percentage of THC. It gives you a high, gives you euphoria, paranoia. And hemp has very small amounts of THC, 0.3% or less. Now, both species have both compounds, THC and CBD. In fact, they have over 140 other compounds that we're going to talk about in the plant. But THC and CBD are the two main cannabinoids that each of the species house. But again, all of our products are sourced from the hemp species. None of our products will give you a high, a euphoria, a paranoia. We even have products that those of you who have random drug screens, can use if you want to have that health without the high, have options that are holistic and organic without failing your urine drug screen. So let's look at some of the benefits of CBD, which are many. CBD or cannabidiol is antibacterial. It inhibits cancer cell growth, and that's why there's a lot of literature out there and research that shows that incorporating CBD can help improve survival rate and even help to alleviate some of the pain and suffering and other symptoms that those who have pancreatic cancer are going through. It is neuroprotective. It helps to restore those nerves that have been damaged due to stroke, other neurodegenerative conditions like Parkinson's, dementia, etc. It promotes bone growth. It reduces seizures and convulsions. It reduces blood sugar levels. And when we talk about the pancreas that helps to produce the hormone insulin, if it's not working effectively, it can cause blood sugars to be elevated. So CBD can also assist with that. It reduces the function of the immune system. It reduces inflammation. We said that one of the risk factors for pancreatic cancer is having pancreatitis, having inflammation of the pancreas. CBD can help reduce inflammation throughout the entire body. It reduces the risk of arterial blockage. It reduces small intestinal contractions. It even reduces vomiting and nausea. We have a lot of that, right? When patients are undergoing chemotherapy, well, CBD can be an aid, a tool to help those reduce nausea and vomiting. It relieves pain in pancreatic cancer as it starts to spread, as it starts to increase in size. It causes abdominal pain. It can cause back pain. So CBD can help reduce pain. It helps to relieve anxiety. You can imagine giving that news of pancreatic cancer, the anxiety one that it must have with that diagnosis. So just helping to reduce anxiety, depression. It helps to slow bacterial growth. It suppresses muscle spasms. It's tranquilizing. It treats psoriasis and other skin disorders. That's one thing that a lot of patients who have pancreatic cancer, even pancreatitis, they have a lot of itching, right? It causes a lot of itching because it's affecting also other glands like the liver and the bile duct, the secretions, and it's vasorelaxant. So it helps to open up and improve blood flow. There are other cannabinoids that you should be familiar with that synergistically work with CBD and really helps promote a full effect. We call it a full spectrum product. The other cannabinoids are CBG, CBC, delta-8 THC, delta-9 THC, THCV, and you can see these cannabinoids also have the same function and benefits as CBD in reducing inflammation, reducing pain, helping to reduce nausea and vomiting, and improving sleep, because that's also another factor that when one gets a diagnosis of cancer, of that stress, anxiety, and insomnia. Well, how does CBD work in the body? It's through the endocannabinoid system. The endocannabinoid system is made up of receptors. The main receptors are CB1 and CB2 receptors. They are made up of enzymes that kind of regulate the amount of endogenous cannabinoids that our body is able to produce. And when we consume CBD, when we consume cannabis, and these receptors are bound with the cannabis, they can send signals to important organs like the pancreas to put the pancreas back in balance. Now, the pancreas could be out of balance because of inflammation. The pancreas could be out of balance because the tumor that's growing. But just know that the pancreas has specific receptors called CB2 receptors that are looking, when we consume CBD, to improve our symptoms when we're dealing with pancreatic cancer. So this is a very detailed system, but it is deemed the most vital regulatory system in our body. It's more important than the musculoskeletal system, the cardiovascular system, the immune system. This endocannabinoid system really talks about bringing homeostasis or balance to our body. But again, many, many major organs, not just the pancreas has receptors looking for cannabis, but the lungs, the liver, the kidney, the skin, the stomach, the teeth, the eyes. So many important organs in our body are looking for cannabis to put it into balance. But again, prevention is key. We have a flat belly lifestyle program that really addresses prevention, that really addresses the toxins that we, for many years, have been fooled by the American diet, right? That eating meat, chicken, animal protein is absolutely necessary, right? And what we're finding through all of the comorbidities that we're seeing, right? We're seeing not a reduction in heart disease, not a reduction in obesity, not a reduction in autoimmune conditions, not a reduction in neurodegenerative conditions. We're seeing an increase in all of these conditions that I named because of our diet, because of what we're eating, because of the toxicity in our body. Now we add on to that the fast food industry, right? We add on McDonald's and Kentucky Fried Chicken and Arby's and Burger King. We add on the grocery store. That's the first thing that you see when you walk in a grocery store is a whole pallet of potato chips, right? Processed foods, foods in bags. And what we have to maintain and continue to understand that it's the produce section is the really only section that you need to live in. Fresh fruits, fresh vegetables, live food is key to keeping our pancreas healthy. It's key to keeping diabetes at bay. It's key to keeping hypertension and heart disease at bay. It's key to keeping obesity at bay. It's key to keeping us healthy. It's key to reversing so many conditions is with our diet. So we offer here at Wakana Flat Belly Lifestyle, where you can choose either phase 1, 2, or 3, plant focus or plant-based, a 7-day or a 21-day detox. Depending on where you are, we can meet you. We can meet you at a place where we can take your wellness to the next level, because it's all about your diet. Your diet, your food, your live food, your fruits and your vegetables is your medicine. Am I saying stop taking your medicine? Absolutely not. But what I am saying is that you must be a part of the Flat Belly Lifestyle if you're not already a part of the Flat Belly Lifestyle. It is a lifestyle where we coach you, we empower you, we educate you on how to transition from animal protein to plant-based way of eating. We teach you about the toxins that you could be eating. We teach you about how important to understand your blood type is key, to find out which foods those are that you should be staying away from. So that is our flat belly lifestyle, phase 1, 2, or 3. Again, depending on where you are. In December, Christmas Day, I jumped right in. I did a 21-day cleanse, and I haven't looked back. I've gone from 174 pounds. I'm weighing in now at 148 pounds. And all this happened since December. I'm a raw vegan. I feel amazing. I have energy. In fact, I am prepping to compete in a bodybuilding contest. Once I hit that targeted BMI, I've got to get my body fat down a lot. But using this as a way of reversing disease, reversing aging, and getting well and prevention. Now, our CBD products, we're going to talk about that can really help those who are looking for products that can assist with their symptoms that they're having if they've been diagnosed with pancreatic cancer. And again, those symptoms can be pain, abdominal pain, back pain. Those symptoms can be nausea and vomiting. Those symptoms can be bloating. Those symptoms can be very uncomfortable, even when they're going through their treatment. Our tinctures are oils that you place underneath the tongue twice a day. We do have 2 lines. We have a power line and a pure line. The difference between the power and the pure is that the pure line can be used by those who have random drug screens at their job. The pure is our broad spectrum line containing less than 0.0% of THC. Will not show up on the drug screen. Our Power Hempranium 500 milligram is our #1 tincture, our #1 seller. It is enhanced with essential oils like black seed. Black seed aids in digestion. Black seed helps with so many organs. Black seed helps to rebuild the beta cells of the pancreas. It really helps to improve blood sugar levels, blood cholesterol levels. What doesn't black seed do? So we've enhanced this with black seed along with turmeric. Turmeric helps to reduce inflammation. Turmeric is good for memory, it's good for the heart. And our carrier oils are MCT coconut and hemp seed oil. We splash a little peppermint in there to give it a nice taste. And this is a great, great product for those who you may know has either pancreatic cancer or other cancers. We're not saying that this tincture will cure their cancer, but it can address some of their symptoms. All of these products are organic. All of our products are tested. All of our products come with a certificate of analysis to ensure that you understand that what's in the bottle is safe and effective for your loved ones and for you. Our Pure, again, is a tincture. All should be taken and started with 3 drops in the morning and 3 drops in the evening. Now, what's very unique about our Pure tincture is the delivery system. The nanotechnology helps to improve the bioavailability of the CBD in our Pure product. Our water soluble is a great, great product. I love adding it to my water, my juice, my smoothies. It's a great product that can be used in anything liquid. So for those who don't want to use a tincture under the tongue, the water soluble is a great product. And then our Hemp MD. Now, Hemp MD is our more potent products, 900 milligrams of CBD. It is for more challenging conditions, for those that may need a higher dose, but starting with 3 drops in the morning, 3 drops in the evening. Now, many patients with cancer, be it pancreatic cancer, undergo chemotherapy. Chemotherapy, even radiation, all of those treatments can cause hair thinning and even hair loss. Empowered Hair is our product that we can address as long as there's a follicle there. That follicle can respond to CBD. So our Empowered Hair is a product that can be used under the tongue as a tincture or it can be used topically right in the area of thinning and issues from chemotherapy or radiation. Now, our topicals are key, is a key part in addressing those with pancreatic cancer. Many times when that cancer starts to spread, it starts to expand, it can cause pretty significant abdominal pain and even back pain. Our Extreme Power Pain Cream is a great product that can help assist and alleviate some of that discomfort. Using that PRN as needed during the day or night. We also have our Dr. Rita's Rub, which is a liquid form that is a roller ball that can be used. Both of these products are enhanced with essential oils like peppermint and spearmint and eucalyptus that help to enhance the CBD's effect of reducing inflammation and pain. Our edibles, our gummies, come in our pure, our broad spectrum, our power, our full spectrum, our Delta 8, our Flight 25, our Flight 50, our Delta 8 products are a little bit more potent than CBD products. So if you're dealing with a client that really is having a hard time with sleep, insomnia, discomfort, the Delta 8 may be something that you want to try. Start low, go slow with the gummies as well. Start with a half a gummy. You can work yourself up. It takes about a half an hour, 45 minutes, sometimes even 2 hours before you feel the effects of the gummies. Now, our Smokeables are fast acting. I love the Smokeables because within 1 to 5 minutes, they're able to kick in. So when we're talking about acute onset of abdominal pain or back pain or nausea and vomiting, maybe they had a treatment that day. These Smokeables are pre-rolls, are cartridges. They come in CBD or Delta 8. These are products also that can really assist and help those patients with pancreatic cancer. I do want to remind you that we have other hair products. We have a whole Save Our Strand line, shampoo, conditioner, leave-in detangler, styling cream, our Ouds body oil. This is another hair system that can assist with those who have undergone treatment and now they want to really target and restore their hair back to normal. These are other products that are enhanced with CBD that can really address that follicle that can be or has been damaged with chemotherapy and radiation. So thank you so much for joining. I'm going to stop sharing my screen. I'm going to take a couple of questions because I've got to get upstairs and see this patient. If you have a question, you can put it in the Q&A area. You can put it in the chat area. And you can also email me. There's my email. I'll leave it up there for a second. RitaMD@wakana.com. RitaMD@wakana.com. Let's see. Are there any? Oh, yes, there's a question in the Q&A. Oh, Karen Williams, thank you. Thank you. Thank you. Karen Williams says, thank you, Dr. Rita. Always informative. Yes, so this is another webinar recording that you'll have. There is a webinar on cancer in general, but this is more specific because one of the distributors asked me to do this topic tonight. And I don't think that distributor is on the line, but that distributor will have that recording along with all of you incredible people. Are there any other questions before we leave tonight? If you're a guest on the line, please connect with the person that invited you. You can get your questions answered further. You can get products ordered. If you're a business distributor, business partner on the line, please remember that you can use any of my videos to share with those that you love and know and may be interested in this topic and other topics that we've done in the past. Well, it looks like that's all the questions. I think that is it. I'm going to wait another 60 seconds before we close it down. Valerie, Abina, Anna, Calvin, Carolyn, Cheryl, Commissioner, Elizabeth Ann, Eleanor, Fountain Doss, Frida, Karen, Kay Wilson, Marguerite, Robert, Stanley, Tony, Rebounder. Thank you so much for joining. Have a great evening. Be well, be safe, and we will see you next Wednesday.